Colorado Congresswoman Lauren Boebert recently underwent surgery to remove a blood clot and subsequently diagnosed with a rare condition called May-Thurner Syndrome. Well, here to share more on what this diagnosis entails is Dr. Adam Tanious, Vascular Surgeon at MUSC. Good to have you with us.
Thanks for having me.
So we say it's rare-ish, but there's actually more people who suffer from this condition than we currently realize.
Yeah, so interestingly enough, so May-Thurner's is actually a diagnosis that is talking about how your body actually formed when you were born and in utero. And it's basically the relationship of your blood vessels to each other and to your spine. And so May-Thurner's is actually been shown to be present in about 25% of the population just in different studies. But only about 1 to 5% of people actually have symptoms from it. So it's actually probably under, that 25% is probably even lower.
Sure.
It's actually higher, I mean.
Higher
in the population, but the number of people that actually have symptoms from it is pretty low, and so that's why it's a little bit rare.
So if you don't exhibit any symptoms, does that mean you're not at risk of anything adverse happening to you, or?
Essentially, I mean.
Is it a quiet killer?
Yeah,
how serious is it?
So, great question. And so May-Thurner's really becomes serious when you talk about what it can lead to, right? And so the Congresswoman had a sequelae, or a bad result from having this diagnosis, which basically, and just to explain it if that's okay,
sure, please,
right?
Yeah.
And so just so everybody's on the same page, you know, our heart pumps blood into the arteries take blood everywhere on the body. That's the blood that has the oxygen, and then it's the veins that are responsible for bringing the blood back to our hearts. And so May-Thurner's talks about compression of the veins in our pelvis. And so what May-Thurner's effectively does is it takes the 4-lane highway that drains all the blood from your leg and squishes it down to about a 1 or 2-lane highway. And so if you are well hydrated and active, again, majority of people that have this compression may never know it because their body has found ways to compensate and deal with it. But if you have a risk factor for this disease, which the documented risk factors are being a woman of childbearing age, and having had children or multiple children, and being on oral contraceptives, and also having a diagnosis of scoliosis. If you have one of those, and dehydration is another risk factor, that compression down to that 4-lane highway down to a 2-lane highway will then potentially make you have a problem from that. And those problems can be leg swelling, and it's always discussed as usually the left leg, but actually it can be left or right. So single-sided leg swelling, and the downstream effects of those are either swelling to the leg with changes to your skin, wounds, etc. Or
that sounds scary. If you wake up and you start noticing these changes in your body, and such a mystery too of not realizing, well, what is causing this? Absolutely.
And so that is one of, I would say that a good majority of people wake up and they can have acute onset swelling to one leg, and that should obviously prompt a call to your doctor or a trip to the emergency room to understand, is that from a blood clot? There's a lot of reasons for leg swelling. But this May-Thurner's diagnosis is sort of further on that list. And what needs to be decided is, do you have a blood clot, first and foremost, because that needs to be treated. And the Congresswoman obviously had a blood clot and received great medical care to get that blood clot treated. But the underlying result or reason for that blood clot was she had that narrowing, and that was something that needed to be treated.
What are the treatments?
The treatments are, so the goal is that you alleviate that compression, right? And so right now we have some pretty awesome technology that allows us to first make sure you're actually have the disease, right? So we can use ultrasound on the inside of blood vessels. And so we can actually take pictures on the inside and to see that narrowing or that compression. Once we've diagnosed that you actually have that compression, the first line of treatment, if you're having symptoms, and those symptoms again are swelling of the leg, heaviness, and then the other thing is something called, if people have heard of the diagnosis, pelvic congestion syndrome for women, so a feeling of heaviness in their pelvic region. This compression can actually be one of the main reasons for that, and then you would look to stent that, and so to basically keep that area nice and open to allow.
Is it invasive?
We would call it minimally invasive.
Minimally invasive.
Right, so it would require
surgery.
It requires surgery. So you'd be under, depending on what your anesthesiologist thought was safe, but most vascular surgeons who do this would do this through a poke in the groin. It would be an outpatient-based procedure.
Okay.
That's, of course, if you didn't have a blood clot associated with it.
I see.
If there's a blood clot,
added, yeah.
then you have to decide how you're getting rid of the blood clot, which is a whole separate topic.
Sure.
And then once you get rid of the blood clot, you're trying to find the underlying reason for why the blood clot happened. And if the underlying reason is this compression, then you would be looking to treat that as well.
I see. So fascinating. Well, Dr. Tanious, thank you so much for sharing all that information with us. And before we go, you have a big event coming up next week.
Yeah, just a small plug for the TEDx event in Charleston next week. I'm one of the speakers, so hopefully people come and check it out or watch it online.
Absolutely. Perfect. Thank you so much, Doctor.
Of course.
Great
Thank
to have
you.
We're back after this.